sitting here today with Dr. Walter, and hi there. And we're going to be talking about the supplements that go along with bioidentical hormone therapy. So, Dr. Walter, what are we talking about today?
Well, along with the hormones, we also, BioT recommends several supplements. This is very different than a lot of places you go into. Some places like GNC or Whole Foods can be really overwhelming because they have shelves and shelves of stuff. And I had a patient last week who brought in an entire shopping bag of supplements, and I stopped counting after about 35. She had 5 or 6 different bags, and some had a dozen in it. And interestingly, she knew what they all were, but a lot of times when patients do that, they've been told, take this or take this, and if it's raining and it's Tuesday, take these 3 here, and they just kind of forget about it or forget why they're taking it. And they obviously spend a lot of money in doing that. BioT is really, really selective. Again, it's been around for a number of years, and obviously there are a lot of supplement companies that would like to be involved with BioT, but right now there are sort of 5 classic supplements that we use, and I'm just going to kind of go over those. And I'm going to be starting with vitamin D, because to me that's really by far the most important one, and I think almost everybody, certainly in New England, needs to know about this and be on it. So this is our vitamin D supplement here, and it's called ADK10 because it's 10,000 units, and then we also have a 5,000 because this is kind of a starter pack, and then the 5,000 is one that would maintain patients, and that's what I've been on now for a number of years. This also has A and K2 in it, and I'll go over those in a few minutes. So the 5 and 10,000 units, again, the 10,000 is for 3 months to start, the 5 is to sort of maintain it. Vitamin D is really, really important for a number of things, and everybody knows it's important for the bones, but that's kind of where the sort of the common knowledge stops. If you don't have enough vitamin D, it's probably more important than calcium, and certainly the two together are more important, but to maintain the bone health. But it also is very important for preventing cancer and for keeping the risk of cardiovascular disease really low. Now, it's a little bit hard without having the actual numbers, but the normal lab values are 30 to 100, and we try to have our patients between 50 and 60. The most common numbers that I see here in New England are between maybe 18, 20, 22, 24. I see that all the time, especially in northern New England. And the reason is because most of the time we're dressed like Terry is, and she's got long sleeves on. And in the summertime we go outside, but we put sunscreen on because skin cancer is obviously bad. So 24, 20, 18 is very common. Sometimes I'll see people in the 30s if they're outside and more active, and rarely I'll see somebody in the 40s and 50s if they're like working landscaping, that kind of thing. As far as toxicity goes, levels of over 100. I've seen that 3 times. Last week was my 3rd time in years of doing this, and she was like 106. And so maybe we have her back down a little bit, but that's not a toxic level. Now, there's really very little risk of overdosing here, and most people only get into trouble if they're over 200 or 300, and sometimes levels of thousands of times higher than we're talking about here. Now, the interesting thing is if you look on your multivitamins, the RDA, the recommended daily allotment or allowance, was just recently changed from 400 to 600, and that's still way, way too low. 400 is to prevent rickets. Now, I've been in medicine over 35 years, and I've never seen rickets. It's kind of, with our diet, we just don't run into that. And there was recently, the Institute of Medicine recently calculated, they kind of looked at the initial studies, and they realized that probably there's a 10-fold error. So when the normal range is supposed to be 400 to 600 now, it really actually is more likely 4,000 to 6,000 for the daily intake. And again, that's not going to get people toxic here. So one of the things I find frustrating is currently the Mayo Clinic says a level of 20 is adequate, and if you look at the science, it just clearly isn't. I just strongly disagree with that. And people say, oh, I take some vitamin D in my milk. That's just not going to do anything. We can just check that with the blood levels. Again, toxicity is extremely rare. Sometimes it has to be hundreds or thousands of times higher than it is. And when that happens, then people have a tendency to really use calcium too much. They get kidney stones, they get hardening of the arteries. But that's not anything we see at the normal ranges, and certainly not something we see at the low ranges. The 10,000 a day, again, we've been using that, and 5,000 a day for years and have not run into trouble, and we've not had overdoses on that. I've had a couple patients, again, the patients I mentioned before that were high, they were in 10,000 or 15,000 units a day. But other patients I've had are on that, and they've been on it for years, and their ranges are right in the 40, 50, 60 range where people should be. Some of the recent science to show why vitamin D is so important, there was a PLOS study that was done in 2016, and it looked at 2,300 women, so over 2,000 women, and they picked vitamin D level of 20 is bad and 48 is good. They ran the study for 3.9 years, for 4 years essentially, and they looked at risk of all different kinds of cancer, except not skin cancer for some reason, but all other cancers, ovarian, breast cancers. And they found in those 4 years a 2/3% drop from people who had low levels of vitamin D. So there was another study in 2005, European Journal of Cancer. So these are all, these are all very worthwhile, legitimate journals and scientific publications. And they looked at 360 women who had breast cancer, and the women who had levels lower than 50, again, not we're talking 18 or 20, which is what we have around here, but lower than 50, there were 6 times higher risk of having breast cancer. That's really very significant. I'm not going to kill you with science here, but Archives of Internal Medicine, 2008, there were 12,000 women, or actually people in general, with vitamin D levels, and they just kind of looked at what people were dying from, and they found a 26% decreased risk of dying from just all different causes, heart attacks, strokes. There's another recent study that looked at older women in nursing homes, and when they gave vitamin D, they found that they got out of chairs better, they were able to walk better, so there was a low risk of falling, and that's often when people are very elderly and frail, falling is often what kills them. They break a hip or they break a wrist and they just have a harder time recovering, and before they have a chance to recover, they can die from that.
Right.
So a lot of science out there, and it's so cheap, it's so easy. Vitamin D is readily available. Again, ours has vitamin A and K2 in it. And interestingly, in Japan, they don't use Fosamax or Boniva, those kind of medications for people who have osteoporosis to strengthen bones. They just use K2, and we have the vitamin D and the K2, and it just helps the vitamin D get absorbed better. So have it tested. It's easy, and talk to your doctor about this. There are a lot of doctors who are now starting to do this. And again, our target here at BioT at New England. Medical Aesthetics in New England. Our target is just to get you in the middle of the normal range. We're not talking crazy high numbers, but docs just aren't used to seeing people with levels of the 50s and 60s. But the science really shows that it's just critically important to do that. It's so easy and so cheap.
Very good.
So,
okay.
The next supplement here is, and these will go a little bit quicker. Most people are familiar with omega-3s. These are the fish oils. They help with arterial health. They help with just a lot of different things, and thinning of the blood and just making the arteries generally healthy. And the benefit to ours is sometimes when people buy them over the counter or buy them at CVS or whatever, if they burp, they taste like mackerel or something, and ours doesn't do that.
Okay.
We just, again, looking at the science, it's 1,000 milligrams. That seems to be a kind of a standard dosage. Very easy to take. This next one here is probiotics. Obviously, people have heard about that. A lot of people are already on it. And when somebody's in the antibiotics in the emergency department, I usually suggest that they go on probiotics just to try to stop yeast infections, and sometimes they get other issues with it too. The probiotics are really easy to take. The reason they're so important is because 60 to 70% of the immune systems are on the intestines, and you have probably 1,000 different kinds of bacteria, and yours are obviously different than mine. So no probiotics is going to give you exactly the perfect 1,000 that you need, or the ideal 1,000. But there are some that have been studied quite a bit. I think the important thing to realize about probiotics is that if you eat yogurt, which has a lot of lactobacillus, live cultures, obviously, there's a lot of good bacteria in there, but your body doesn't know that. So if you eat yogurt or eat these smoothies with probiotics in it, what happens is it goes into your stomach acid breaks it down, and most of those good bacteria are killed. So they're just turned into, food substance for the body. So you're getting maybe 2.5 to 5% survival through the stomach if you just drink it that way.
Okay.
The benefit to ours, it has a couple different active bacteria in it, but the capsule is patented, and it goes through the stomach acid, doesn't get dissolved till then, so it gets into the intestines, and then it dissolves, and you're getting 65, 70% survival. So again, we think ours is better, but I think more importantly is that people are actively on probiotics and eating healthy. And again, if you have any questions, any of this stuff, please call us and we can go over some of the specifics. The last two are iodine and dim. Iodine is something everybody's heard of. It's an iodized salt. This is, it's a very inexpensive supplement. And the reason we use it for two reasons. One, it's one of the stronger antioxidants that's available out there. And it's very important for breast health and prostate and ovarian. And it's obviously also important for the thyroid. When we talked before in the other video that we had done, we talked about T3 and T4. Well, T3 is your body using 3 iodines to make that hormone, the T4s, 4 iodines. The confusing thing about iodine, because everybody thinks that they have it in their salt, is that they really don't, because people don't use Morton's iodized salt anymore. Usually what they use is sea salt, which really doesn't have a lot in it. And also it doesn't last that long if it's sitting on the shelf for a number of years. And depending what the diet is, there's also a product that's in a lot of foods, like Gatorade has it. They're trying to get rid of it, but some of the lemon lime sodas like Slice, it's in pesticides in strawberries. But the most common thing is in baked goods as brominated flour, and that has bromine in it. And the FDA does not require that to be listed. So a lot of times you don't even know that it's in the foods. And what the bromine does, it'll plug up the iodine receptors, because in the periodic table they're very close to each other, but your body can't do anything with it. So the one thing with the iodine, we have a higher dose than you'd normally get in the multivitamins. Sometimes you can kick the bromine off, and occasionally people will get a detox for a few days. And we go over that with everybody. Most people tolerate it fine as long as they have a reasonably healthy diet.
Okay. And the last one's DIM, right?
And the last one's DIM, yeah. And the iodine is the dosage we use is much higher, again, as I mentioned before, than it is in the multivitamins. And it's what the traditional Japanese diet have. They eat seafood and they eat kelp, and so it's a higher level of iodine. They do completely fine with it, as long as they don't have Hashimoto's. You need selenium for that. Ours has that already in there, so it's not an issue with Hashimoto's.
Okay.
You mentioned the last one here is DIM. This is diindolylmethane. This is the active ingredient in Brussels sprouts and broccoli, but you got to eat like 2 pounds a day, and even if you love it, most people don't do that.
Right.
The DIM is important for 2 reasons. When you do the hormones with us, then it'll make more of the free testosterone available, and the free is the usable one that the receptors can see. So you kind of get more bang for the buck for what we would be giving you. The other thing is when testosterone gets broken down, it gets broken down into a number of different other substances, and some of them are estrogens, and there's sort of good and bad estrogens, and this makes it go down towards the good pathway. The bad is more stimulating. If there's a small breast cancer or something in there, it can be more stimulating. This is actually protective, so that's why we suggest people get on the DIM. So again, those are the only supplements we have where we really vet the whole process of, there's really, I think I've read recently there's 90,000 supplement manufacturers, not supplements, but manufacturers. So there's lots of them out there, and everybody has, the best mousetrap out there. But BioT is really very careful about vetting which supplements that we suggest people, because it can get pretty overwhelming quickly. There was a famous news article that came out like a year ago or so that they looked at some of the supplements at GNC and I think they went into Whole Foods and some of the CVSs and common supplements, and they found there was just such a huge variation in dosage, and you really don't know what you have because it's not really regulated. We know exactly what we have, and I use the products myself, and I think a lot of the people in the office, most of the people in the office use these too.
Right. Well, great. Wow, this is a lot of information.
A lot of information.
I'm glad that you have broken it down for us, and it's good to know that this is part of the bioidentical hormone therapy, just to enhance everything that people do. So thank you so much for today's show.
Thank you very much, and thank you.
And we look forward to seeing you next time. Thank you.